Alright guys, I'm back on here to follow up with a post I did the other day regarding golfer's elbow. I'm going to show you some mobility techniques to the soft tissue and also some loading strategies that are important to heal the tendon, especially in the initial phases. So first thing you want to have or get is a lacrosse ball, okay? And you want to find that medial point of pain in the elbow, okay? And you want to just rest your arm on that, play with it a little bit, find that soft tissue point that's a little painful. And then bend that wrist back, push down, add some pressure. Hold for 3 to 5 seconds. Back to neutral. Do that about 3 to 5 times in each spot as you roll down the forearm, hitting those muscles in those tender spots. Okay? After you've done that, you're going to want to stretch out the tissue in a dynamic fashion. So I like this one where our wrists are extended back, okay? And then we just lean backwards. Hold 3 to 5 seconds, come back. Make sure you keep that palm flat, don't let it rise, okay? And do that about 10 times. Now, to load the tissue, you wanna do it in an eccentric fashion, okay? So, especially for the tendon, healing and repair of the tendon. So, we're going to do, first we're gonna do an isometric one. That's what I like to start with. Then we get into the eccentric phase of exercising. So what I like to do again, get in this position where you stretch, okay? And you're gonna push down, bend back and push down that forearm into the surface. You can use a ball. Let me see if I have one. You can do it with a ball. Push down. So we're not changing the muscle length, but we're getting activation in that muscle. Then release. Again, 3 to 5 seconds with these. Start at about 10 times. You can also do that on the wall. And then the last one, you're gonna take a weight, okay, light weight. You want your arm to hang off the side. So I'm a little bit, you wanna be more like this way with the table edge right here, so you can do this motion, okay? We're just gonna hold and then come back. Hold it in this position. You can push that elbow down into the surface and then come back. Okay? Again, hold about 3 to 5 seconds with that external resistance, which is the weight, and then do that 10 times to start off. And that should be a good little exercise program to get you, activating the muscle, healing the muscle, releasing the muscle, all those good things for tendon healing and repair when you have golfer's elbow or medial epicondylitis.